Do weight loss medications work? Are they safe? And what happens if I stop taking the medications? Today, I'll be answering some of the common questions I get about weight loss medications that I listen to and hear every single day. Hello, I'm Dr. Terence Tan from Halley Body Slimming Clinic. There's a lot of interest around weight loss medication, but there's also a lot of uncertainty and concern. And therefore today, my goal is to help you understand the facts and the questions behind them. Number one, do weight loss medications actually work? Well, of course, weight loss medications can be effective for some individuals, but results are not the same for everyone. These medications are designed to support weight management by influencing appetite, satiety, or metabolic pathways. They are, however, not magic solutions, and they do not override biology or lifestyle factors entirely. In clinical settings, we focus less on dramatic short-term weight loss and concentrate more on whether a medication helps someone manage their weight in a sustainable and medically appropriate way. Number two, how do these medications work and what are the types available? When weight loss medications are discussed today, they are generally referring to treatments that act on the body's appetite regulation and metabolic signaling systems. One commonly used group of medication is known as GLP-1 receptor agonists. These medications are based on hormones that are naturally released in the body after eating. They influence appetite regulation, feelings of fullness, and the rate at which food moves through the stomach. Liraglutide and semaglutide are examples of these medications within this group. While they act in a manner similar to our own biological pathways, they differ in their dosing, schedules, and pharmacological characteristics. There are also medications that act on more than one hormonal pathway. Tirzepatide, for example, acts on both GLP-1 and GIP receptors. These hormones are involved in appetite regulation and metabolic processes. Although these medications differ in how they interact with the body, they are all intended to support weight management by influencing biological signals related to hunger and satiety, rather than forcing weight loss. The choice of whether to use medication and which type to consider depends on the individual medical factors and should always be assessed by a healthcare professional. Number three, why do some people see results while others don't? Well, response to weight loss medication varies due to individual biology, hormone sensitivity, lifestyle factors, stress, sleep, and also underlying conditions. A lack of response does not mean someone is doing something wrong, nor does it reflect a lack of effort or discipline, because weight regulation is complex and variability is expected in medical treatment. Number four, what about the side effects and safety? Well, safety is one of the key concerns and it should be. Like all medications, weight loss medications can have side effects. These may include gastrointestinal symptoms or temporary changes as the body adjusts. This is why proper medical assessment, dosing, and follow-up are essential. When prescribed appropriately and monitored, we aim to balance potential benefits with potential risks on an individual basis. Question number five, is long-term use of weight loss medications safe? Well, long-term use of weight loss medications is an area of ongoing medical research. What we do know is that treatments are not static, they are reviewed regularly, adjusted when needed, and discontinued if risks outweigh the benefits. Because most people don't think that they need these medications for the long term, the approach should be gradual, flexible, and medically supervised. Number six, what happens if I stop taking the medication? Will I regain the weight that I lost? Well, weight regain can occur after stopping any weight management intervention or medication because the body naturally resists changes in weight. This reflects the body's natural regulatory mechanisms rather than the effectiveness of a treatment. In medical care, weight management is viewed as a long-term process rather than a one-time outcome. Question 7. Is it appropriate to use weight loss medication if I'm not overweight? Well, this is a common and important question. From a medical perspective, decisions about treatment are not based solely on labels such as overweight or normal weight. These categories are population-based and do not always reflect an individual's health status. In clinical practice, factors such as medical history, metabolic risks, weight changes over time, and overall health are considered together. Weight loss medications are part of medical care and may be appropriate for some individuals but not for others. And therefore, assessment and medical supervision are important to ensure safe and appropriate use. Number 8. Many people feel guilty or uncomfortable about using medication. Why is that? This is an understandable feeling. In many cultures, including some Asian contexts, weight loss is often associated with ideas of poor willpower and poor discipline. As a result, using medication can feel like taking a shortcut, even when it's medically appropriate. However, from a healthcare perspective, medical treatment is not about avoiding effort, it's about reducing unnecessary physical and psychological burden. Needing support doesn't mean someone lacks effort or willpower. Number 9. So, who might consider weight loss medications and who might not? Weight loss medications may be considered for individuals who understand both its potential benefits and limitations and are willing to engage in ongoing medical follow-up. It may not be suitable for those with certain medical conditions, unrealistic expectations, or discomfort with medical treatment. Choosing not to use medication or deciding not now is also definitely a valid outcome or valid decision. Weight loss medications are neither a miracle solution nor an indicator of personal effort or poor discipline. They are one of several medical tools that may support weight management for some people under appropriate guidance. It is normal to feel curious, cautious, or even conflicted. Taking time to understand your options and asking questions is part of responsible healthcare decision making. Always consult a qualified healthcare professional for personalized medical advice. I hope this video has been useful. This is Dr. Terence Tan saying goodbye, and I'll see you in the next video.